Carolina, also a member of the Energy and Commerce Committee and a co-sponsor of this bill, Ms. Renee Elmers.
Thank you to the gentleman from Pennsylvania. I, too, want to thank him for his tireless work on this effort. This is such an important piece of legislation in dealing with mental health and putting necessary reforms in place. The gentleman has truly been an absolute champion on this issue, and H.R. 2646 is such a meaningful piece of legislation that will help in so many different ways. Mental health in this country is a crisis, and it is an epidemic. And there are so many families across this country that are dealing with this issue. You know, the gentleman came to my district a little over a year ago, and we had a wonderful roundtable discussion, and there were so many individuals who came to it, so many family members who came to it to speak on this issue, and they were so appreciative of the fact that there was actually some legislation that was being developed to deal with this issue. These are families that have nowhere else to go. And in my experience as a nurse in healthcare, but then also as my experience has gone forward in taking care of those in my district, but then traveling across the country, meeting with families and talking with individuals, how much this affects their lives. And they truly, it's almost amazing when you start having the conversation about this piece of legislation, because I don't even think they think that anybody wants to help them anymore. I think they feel so far and left behind that it isn't even in their mind that someone is out there looking for an answer and helping in a way that will be meaningful into the future. The gentleman from Pennsylvania has done extensive work with so many groups, so many patient advocacy groups. His own personal knowledge as a child psychologist has played into this issue. There are certain barriers that are in place, and they're in place because we've put them there. Well-meaning, well-intended, HIPAA laws, all of these things that have been put in place to help protect patients and their privacy and their issues, and yet it prevents us from being able to understand this situation. It prevents families from being able to get care for their loved one, maybe an adult child, of parents who are struggling to help their child, their son, their daughter. They may be out on the street, they may be at home, they may have issues, they may not be working, there are so many different things that can be happening, and they know that that individual needs help, and they have no one to go to. This legislation will change much of that. It is a step in the right direction. There's much more that needs to be done. You know, we were just talking a moment about our jails, our prisons, and how many of those who are within those walls and those bars literally are there because they have mental health issues. That yes, they may have committed a crime. Yes, they may have found themselves in a terrible situation and ended up in jail, possibly even drug abuse. But the bottom line is the mental health issue that lies there. And when we're talking even about issues of fiscal responsibility in this country, when I think of how much money we will save and how much of a difference it will make if we deal with this issue in the way that it needs to be dealt with. So I am a co-sponsor of this legislation. This is an incredibly important piece of legislation. It is bipartisan. It is for every American in this country, every American in this country that is dealing with this issue, with a loved one, with a friend. We all have them. We all walk down the streets and see individuals who we know are homeless, and we know that the root cause is mental illness. We can change something in this country. This is one change we need to make. We need to come together as a whole House of Representatives to pass this piece of legislation. And again, I just want to finish by thanking the gentleman from Pennsylvania one more time for his tireless efforts. You have truly been the champion for every mental health issue, and this piece of legislation passed by the House of Representatives will be a monumental step in the direction of mental health reform.